All right, greetings everyone, and welcome to the Institute for Public Health and Medicine seminar series presenting the OSHA Grand Rounds. Please be aware that we will not be monitoring chat during the seminar. If you have questions for our speaker, please use the Q&A function, and we'll do our best to answer them at the end of the talk if time permits. I am Anna Shanahan, and I am the Associate Director of Education at the Osher Center for Integrative Health at Northwestern. And it is my pleasure today to introduce David Victorson. He's a licensed psychologist, professor of medical social sciences, and director of the Flourishing in Society and Health Research Lab at Northwestern's Feinberg School of Medicine. He's director of integrative oncology research at the Cancer Survivorship Institute at the Robert H. Lurie Comprehensive Cancer Center at Northwestern, and co-founder and executive director of the young adult cancer support nonprofit True North Tracks. His research focuses on the development and delivery of biobehavioral interventions aimed at increasing mindfulness-based emotion regulation, social connection, nature contact, and engagement in positive health behaviors on health, well-being, and flourishing, spanning people, population, and planet. Thank you so much for being here today, and we're excited to hear your presentation.
Thank you, Anna. Can you hear me okay?
It sounds great, thank you.
Great. It's so nice to be here to share about this topic that is close to my heart and in a great way, a part of my job. So I'd just like to start by saying I have nothing to disclose except that I am a big fan of being in the outdoors. And I think it's appropriate just to start from our sponsor.
Do you find yourself longing for the apocalypse? I did. I was looking for a reason to live. Hi. Are you feeling tired, irritable, stressed out? Well, you might consider nature.
From the people that brought you Getting Outside comes prescription strength Nature, a non-harmful medication shown to relieve the crippling symptoms of modern life.
Nature's recommended for humans of all ages, and it's great for pets too.
Nature can reduce cynicism, meaninglessness, anal retentiveness. In clinical studies, Nature is proven to decrease work-induced catatonia.
Caution. Nature may cause you to slow down, quit your job, or seriously consider what the you're doing with your life.
If you are overly cynical, jaded, or emotionally numb, you may need to increase your dose of Nature. Do you have trouble being even mildly uncomfortable? Nature may not be right for you. Side effects may include spontaneous euphoria, taking yourself less seriously, and being in a good mood for no apparent reason.
So ask your doctor if nature is right for you.
Thank you for watching that with me. I never get tired of seeing that video. I think it's so excellently done. As Anna mentioned, I direct the Flourishing in Society and Health Research Lab. We define flourishing in the following way and understand it, that it's a process of being curious and open to our experiences, how we might grow and learn from them, intentionally living our lives with authenticity and presence and compassion, engaging in personally meaningful, purpose-driven pursuits, as well as being mindfully awake, aware, and connected to ourselves, to others, and to the world in which we live. And in that spirit, we focus on these 5 different pillars that where we try to increase flourishing across these domains. And as you can see at the end, one of those is contact with nature, both for human health as well as for planetary health. Just a little bit about some of my background in this area. I started and am a co-chair of the Nature and Health Special Interest Group through the Academic Consortium for Integrative Medicine and Health. I was an advisor on the creation of a short film called Nature, No App Required, which I hope we get a chance to watch near the end of this, that has to do with nature prescriptions for patients. And I sit on the advisory board of the Nature, Culture, and Human Health Network, which is a nonprofit organization that seeks to increase nature access to people who've especially been redlined from getting equitable access to nature. And then, as Anna mentioned as well, I'm also a co-founder and a director of a nonprofit organization called True North Tracks, where we help young adults and caregivers affected by cancer find direction through connection. We focus on 3 crucial connections that are often missing from traditional conventional healthcare that we think have big import. And one is connecting with nature after the very unnatural experience of cancer and its treatment. The second is to connect with others who have walked a similar path and get it and experience the power of finding and being found. And then lastly, to connect with oneself through mindful awareness practices like meditation and yoga. And so in a little bit, we'll get to talk about some of the outcomes of that program. But I'd like to back up and just start with the question, what is it about being in nature that can be so healing and restorative and even transformational? And does anyone here have any personal connections or stories about your affinity to being in nature and how it may have helped you in some way? We know that nature dates back nature, our awareness of the benefits on our health and well-being in nature dates back since the beginning of our time, that it spans cultures and peoples, first peoples and natural settings, that nature can serve as a place of refuge and comfort, especially in times of challenge or distress. We have centuries of writers and composers and painters and poets who have written about the awe and wonder and serenity and peace of nature. And now we're starting to see more and more physicians and teachers and researchers also making similar recommendations. I'd like to start with a brief story that relates to my connection to nature. And this story starts with a woman named Delilah, who in 1956 was raising 3 rambunctious boys. And Delilah was actually waiting for her 4th son, Dale, to come home for Mother's Day from military leave. And tragically, Dale was killed in a car crash en route back home to see his mom for that weekend. And the way the story goes is that Delilah was so despondent from the death of her son that she couldn't eat, she couldn't sleep, she wasn't speaking to anyone. And the only thing that her husband knew to do was to drive her out into the forest in the Upper Peninsula of Michigan to a place where they would pick wild blueberries. And she sat down on a log, and it is in that moment, she recounts, where the forest began to speak to her. And this is what she said. The forest said, "Oh, how I love to walk out in the woods. In its calm and still beauty, I have long understood. As I look at the wonders our Creator has made, all the hustle and bustle of this world seems to fade. Down in the meadow, you hear the call of a lark, while high on the hill, some deer feed on bark. There are wintergreen berries and wild onion shoots, an abundance of flowers and trailing green roots. Now, if you go in the forest with the world, you're off key, and you're quiet and still, and you sit and you see. Here you know of God's love, and you know by God's grace of all worldly issues you're able to face." So that was my grandmother, who would recite this poem to all of us our entire childhoods and really laid a foundation for the importance of connecting with nature, especially during some of life's difficult times. So today we're going to review some of the mental health benefits of spending time in nature. We'll take a deeper dive in looking at outcomes from an immersive nature-based program that works with young adult survivors, cancer survivors. We'll talk about the importance of a concept called reciprocity and interdependence, so that we're not just solely focused on nature's role on human health, but also its possible role with planetary health. And then we're going to talk about some actionable steps that we can use with patients. Do you have a favorite type of nature? Is there something that draws you in or captivates your attention? Sometimes people are drawn to the mountains or to oceans. What's your particular kind of nature that you're drawn to? When was your last experience in nature when you were mindful that you were in nature and that you were experiencing some kind of pleasant sensation or emotion as a result? What's the most regular or consistent kind of nature contact you in which you engage, if any? And have you ever prescribed nature contact to your patients? Over the last several decades, increasing attention has been focused on this relationship between nature and human health, and that nature contact can confer a host of different health benefits spanning cognitive, affective, social, physical, behavioral, and physiologic domains. Connecting with nature for this transactional sake of a health benefit is largely a modern pursuit that when we think about other ways in which this has happened, we can look at traditions like yoga or meditation that have historically, throughout the millennia, been lifestyle practices that we have turned into a what can this do for my health type of a practice. And we've done the same thing with nature. We're curious about what the optimal dose is. How much do I need? How often do I need to be in it? Is there a certain kind of nature that is good for my health? And it's not bad to do this, but it's also good to realize that it is contrary to what traditional wisdom and approaches have taken with nature, where nature has also been more or less a natural extension of oneself, one's lifestyle, and one's ethics. Throughout millennia, ancient societies and peoples left signs and cultural artifacts that highlighted the vast interconnectedness and interdependence that they had with the natural world for everything from health and healing, but also for survival and for spirituality. There's a concept called biophilia that was, in Greek, it means love of life and the living world. And this was made popular in the early 80s by the American biologist E.O. Wilson. And he believed that since humans evolved in nature, that we have a biological need to connect with it, that we love nature because we've learned to love the things that helped us to survive as a species. And we feel comfortable in nature because that's where we lived most of our time on Earth as a species. So that in some ways, we're genetically wired to have an affinity to nature. And just as we have a natural affinity to experience fear or disgust of certain natural phenomena, for example, we are able to detect a snake pattern more quickly than other patterns. We have a gag reflex that can happen when something like meat might be rotting. That we also have similar affinity to certain kinds of places in nature that were helpful for our survival. So for example, we might have an affinity to large bodies of water where we could get water to drink, or we could encounter wildlife to hunt, or we could use it to escape on a watercraft if there was a threat. We're drawn to forest habitats where trees could be climbed to evade predators, or again, we could engage in hunting and gathering. And then we're also drawn to vast open spaces, as well as mountaintops, where we could have a visual openness to see food or oncoming threats. There are a couple theories beyond biophilia that I want to talk about, where that can help us frame why we might have a tendency to be to have an affinity towards being in nature. And one is the psychophysiological stress recovery theory by Ulrich. And this theory proposes that natural environments promote recovery from stress while urban ones hinder that same process. And that being in an unthreatening natural environment or viewing natural elements like vegetation or water, that it can immediately activate a positive emotional response for us. And then in turn, decrease things like blood pressure, heart rate, as well as other regulatory systems in the body to help decrease the stress response through a parasympathetic nervous system response. And that, the theory is that because humans evolved in natural environments as opposed to urban ones, that we're more inclined to have these kinds of responses. Interestingly, Ulrich was conducted one of the first scientific studies in the early 80s, where they looked at the records of 23 matched pairs of gallbladder surgery patients. And these patients were matched for age and sex and health and weight, smoking status. And they had half of the patients in a room that had a view of a courtyard and a tree, and then half had a view of a brick wall. Otherwise, the rooms were identical. And in looking at their recovery records, they saw that those in the room with a natural tree view had significantly less time spent in the hospital post-op, that they elicited less negative comments to the care staff, and then they used significantly less analgesics compared to those who had the brick wall. So that was one of the first studies that got people interested in just seeing nature and its possible benefits. Others have replicated these findings that seeing, hearing, smelling, touching things found in nature can also have positive health benefits for hospitalized patients, looking at similar outcomes like stress, use of pain meds, blood pressure, et cetera. One of the studies that looked at the recovery rates of 80 women who underwent thyroidectomy, and they found that those who had flowers or plants in their rooms, again, had significantly shorter hospitalizations, less use of pain meds, lower ratings of pain and fatigue and complaints. Another theory, in addition to the one by Ulrich, is that also gets a lot of attention, is attention restoration theory. And this was created by Kaplan and Kaplan, and it proposes a more cognitive explanation for some of nature's restorative characteristics. They suggest that we have two types of attention. One is a directed or a voluntary type of attention, and that's used, when we need to be deliberate and sustain our attention on tasks. And then we have an involuntary attention, or they call it a soft fascination, which doesn't require this purposeful effort. And that, through the use of our directed attention, we get tired, we get mentally fatigued, and then, we're less able to function well. And that mental fatigue can lead to emotional distress. And that, according to the Kaplans, being in nature can being able to, it can help us connect with this involuntary, effortless attention or soft fascination. And that through doing this, it can restore our attentional capacities and, kind of recharge our batteries. And they talk about 4 components of this theory that have to be in place for it to work. And one is this notion of being away, that being in nature helps us be away from our current environment. And to them, being away doesn't mean you have to be going to Yosemite or the Grand Canyon. It could be being away in your mind, or even just a soft or a gentle shift in perspective is enough to be away. But it has to be enough of an environment where you can engage in this soft fascination, where you're able to pay attention in a gentle and again, effortless way. The other 2 components, one is extent, and that just means that the environment, it has to allow us to feel immersed or engaged in a different place. And then compatibility, maybe one person's nature isn't compatible for another. So there has to be this value of it's compatible with what you like and appreciate, and therefore all those other things can be met. So a lot of times when we talk about why we think nature might have positive benefits on health, we think about some of these different theories. Some of the research to date has shown that people who have access to nearby nature, parks, forest preserves, green space, that they are overall healthier than people who don't have access to nearby nature. And that the long-term indirect impacts of this also spills over into job satisfaction and life in general. There's been growing research out of Japan on something called forest bathing, where people spend 3 to 4 days camping, essentially, and in engaging in nature connecting activities while forest bathing. And they're looking at natural killer cells, and they found that a couple studies now that there's a significant increase in natural killer cell activity, as well as a release of anti-cancer proteins with effects of up to a month from a 3 to 4 day stint in one of these environments. There's a group out in Colorado that are looking at the recalibration of our circadian rhythms through being outside, doing things like camping. But we know that with our increased use of electrical light and, it can cause lots of disruptions to our circadian rhythm patterns and our sleep. And then that can have a spillover effect into all other kinds of harmful things to our health. And so that we know that our internal biological clocks sync with natural midsummer light dark cycle. And this group found that just a week of camping outdoors is enough to reset our body clock back to its natural sleep wake rhythms. One study found that over 1,500 people who took part in a group-based nature walk reported significantly lower depressive symptoms and stress compared to a non-nature walk. And this was after controlling for things like social support and physical activity. Those are two things that people often will wonder about when we are looking at data from these nature studies, is were they with other people, and what kind of activity was happening as well, because we know the benefits of those things. This one study out of the University of Exeter gave us that magic number that people want when they want to know how much is enough. And they found that in a study of over 20,000 people, that people were substantially more likely to report good health and psychological well-being after 120 minutes a week and of nature contact. And this could be really any kind of green space, from parks, to other kinds of spaces, and natural environments. They found that the 2 hours, though, was a hard boundary, and that the study showed that there were no additional benefits for people who didn't at least meet that threshold. We know that not all green space is created equally, and that there are millions of Americans who lack access to safe and nearby nature, and that this can only then exacerbate health inequities to groups who already have limited access. What's paradoxical here is that we know that exposure to nature disproportionately benefits marginalized populations, this ecogenic effect. And that in a review of 90 studies on green space and health outcomes, it demonstrated that those of a lower socioeconomic status showed greater benefits to nature contact than those of a higher SES. When we start to dig into the quality of evidence of nature research, like a lot of new areas, we're still in our infancy in looking at this. And like most new things, where we first start out maybe anthropologically and then qualitatively, and then maybe with a single arm design with a pre-post, and we're increasingly increasing our rigor in the research. For the most part, over the last decade, we've seen studies that involve active engagement in nature through physical activity, some with passive engagement, again, things like a room with a view or resting outside. And then there's an increasing focus on virtual exposure, things like watching videos or looking at images. And now with virtual reality, more is coming out in that as well. There have been a few natural experiments and randomized controlled trials to look at this, but it has really only begun to take off over the last decade. My colleagues and I, we wrote a paper a few years ago trying to summarize the field of what we called nature as medicine. We defined nature based on other people's definitions, and it's actually a hard thing to define. It can mean a lot of things. And so when we look at the nature literature, we want to make sure that we're trying to define it to our readers so they know at least what we're considering and not. In our definition, for example, we didn't include contact with animals. We didn't include contact with food systems, even though those also by other people's definitions might have a place in a nature definition. In our paper, we did a quick search of NIH-funded initiatives that were supporting nature-based work, mostly through the keywords green space. And we found a few. And just before this talk, I did another search, and there we go. And saw that, in the last couple of years, the number of studies looking at nature contact in health has doubled. And it's also including some different funding institutions, which is good to see. I'm a co-investigator on an RO1 by MPI's Mark Perrier and Terry Horton. And this one is looking at the effects of walking in green space in a pre-diabetic group. We are doing a randomized crossover trial in St. Paul, in Minneapolis, and in Chicago. And we're looking at differences in physiologic, psychological, and cardiometabolic risk factors between walking in urban green space and urban gray space with adults with prediabetes. And their prescription is to walk 150 minutes a week for a 6-week period in each of these spaces, separated by a 5-week washout period. So we're really excited just to look again to see if and what kinds of differences we might notice between being in places like a forest preserve or park or other natural environments with being in more gray space environments. When we look at the quality of and rigor of nature research, we need to evaluate it across multiple different criteria to really know what's being done. And Frumkin and colleagues put forth a matrix of pathways that we have added to and adapted so that as we're evaluating nature research, we can see more or less, what they did. We want to look at the spatial scale. If you look at the far left, was it a potted plant or a window view, or was it spending a week with multiple nights in the wilderness? We want to look at the frequency and duration. How regularly was the contact? Proximity is just how close is nature to the person? Is it in their day-to-day environment, or is it a far trip away? We want to look at the activities they do, whether they're sedentary or movement-based. This is an area that I'm really interested in, is the level of awareness. Do we have to be paying attention to being in nature to derive some of the health benefits from it? Or can we be on our headphones listening to a podcast and not really be tuning in that much to where we are? We want to look at some of the different sensory pathways engaged, whether or not we're with other people or by ourselves. And then looking at whether or not the relationship to nature is, a materialistic or a relational one. Meaning, are we there? Is exposure about the abundance of vegetation, or is it about certain meanings and attachments that people have about being there? And then, did the intervention or program have any notion of reciprocity? Was there any aspect of it that helped people also understand that their being there could also have a benefit on the health of the planet? This is just two of those criteria put against each other. If you look at the x-axis, it's frequency, and the y-axis is the scale. And you can just kind of get a sense of some of the different ways that connecting in nature can show up, and just by looking at two of those criteria. I'd like to now transition to a deeper dive on the nonprofit that I direct called True North Treks, and share some outcomes data that we've collected over the last decade with some of the groups that we work with. I mentioned before that this nonprofit helps young adults and their caregivers find direction through connection. And we take groups on free backpacking and canoeing treks. We also, in 2018, were given a beautiful retreat center in the Upper Peninsula of Michigan on the shores of Lake Superior, so that we could also work with people who didn't want to go out to the backcountry of Utah, but rather wanted to sleep in a bed and use a bathroom, but still have access to beautiful natural environments. Through our program, I just tried to identify what some of these different pathways are of nature contact. The spatial scale is generally large, and the proximity would be far. Most people have to go a good distance to get to one of our treks. The frequency of contact is usually once, although some people might go on a couple or 3 different experiences with us. The level of exposure are multiple nights, because we go for a week at a time. And the activities engaged are social and they're movement based, but they're also they can also be sedentary and individual, as we do have times where people are by themselves engaging in some of the mindfulness practices. In terms of their level of awareness, we make sure that people are very tuned in to where they are in a very mindful way. And, all of the other areas, from sensory pathways to contact with others, they're all high on our treks. In terms of how we engage nature, we don't coin or frame what we do as being adventure or wilderness therapy. nor do we try to increase perceived risk or challenge. Instead, and nor do we use this as just like a recreational weekend or party, but rather we try to use nature as what we would call a holding environment. And the term holding environment comes from the psychoanalyst Donald Winnicott. Some of you may be familiar with his work, where he was observing that this natural loving connection between a mother and their child provided this attentive holding environment to the baby's needs. And he extrapolated this notion of a holding environment to the psychotherapeutic encounter, where we can also, as therapists, support our clients with this holding space. And we try to think of nature as a similar container. And that can imbue psychological and physical safety, a sense of quiet and spaciousness, feeling grounded, and also being in a timeless environment, where there are concepts that you might notice come from Buddhist philosophy of no self, being interconnected, constant notions of impermanence and change, a bathing of the senses, moments of savoring and fascination, awe, wonder, gratitude, reflection. Being in nature is a mirror to all of these things. Constant examples of the birth and death cycle, being around other people for regular connection, rebooting and resetting. And I also, as a health behavior researcher and psychologist, like to think about what are some of the other evidence-based therapies and lifestyle activities we know through the last 2 decades of evidence, research evidence to show that can be beneficial. And we know that exercise and movement and physical activity tops the list, as well as social connection and support, as well as behavioral activation and emotion regulation activities, as well as cognitive reappraisal and restructuring. And I lay these things out because even though we don't explicitly seek to teach these things on these treks, these are the elements that come up on our treks. And I just wanted to show you a few pictures now to illustrate how some of these things can come up. First being movement and physical activity. As I said, we're hiking and kayaking and canoeing, and every day has movement of some sort. And then another major connection is this connecting with others. So all of our experiences are group-based, where participants have unfettered opportunities to connect, where they don't have to go home after the end of a group, but rather they can continue conversations that start in a tent and continue on along a trail the next day, etc. And so there's just lots of opportunity for oxytocin to occur. Then in terms of behavioral activation, distraction, and enjoyable activities, being out in nature, again, it engenders opportunities to have fun and to play and to do things to engage the natural surroundings. Through our mindful awareness practice program, we are purposely teaching mindfulness skills and engaging in mindful movement on a regular basis. So again, these things show up on a regular basis. And then just a few to show these metaphors of nature as a holding environment, everything from presence and patience. The actual nature itself is a metaphor to a lot of these concepts, things like impermanence, rebirth, clarity, letting go, literally, an elk shedding its rack, community, as well as things like awe and a sense of cosmic insignificance. So in terms of how we know how this helps. Since this organization started in 2008, we've been administering pre-post surveys, as well as over the last several years, administering short forms from PROMIS, depression, anxiety, and sleep disturbance. And in 2016, our lab had some extra finger prick blood spot kits where we invited participants, if they were interested, to have their finger pricked and their blood analyzed for C-reactive protein and interleukin-6. And all of this was collected as a part of our regular program evaluation. And the data that I'm going to show you was then submitted to our IRB and approved for us to analyze it in this way and to publish it. These are just some examples of collecting blood spots out in the field. And our team presented or we published our findings in the International Journal of Environmental Research and Public Health a couple of years ago. Basically, just looking at data from 2016 to 2021, where we had the PROMIS measures included, and you can see the survivors and caregivers, where some engaged in a week in the backcountry and others were at the Nature Retreat Center. The majority were, around 35 years on average and female. And in terms of cancer types, breast and hematologic cancers were the most common. And we found some significant and large improvements in a host of outcomes of interest to us. One, in feeling more connected to nature. It didn't matter if you were in the backcountry or at the retreat center. Participants reported feeling more attuned and connected to the natural world. And you can just see from some of these quotes that being in nature brought people back to their childhood or to their senses and helped them really appreciate and connect that. We also saw significant increases in participants feeling more connected to other young adults or caregivers affected by cancer. People, feeling that was the first time in a while they could really be themselves and feel accepted by other people around them. And then the darker bar is the survivors, the lighter bar is the caregivers, but we also saw significant pre-post decreases in depression, anxiety, and sleep symptoms, with similar comments being made just about people feeling renewed and at peace and, feeling like they haven't experienced growth like this before. What's nice about PROMIS is some of the measures, it can show you different cut scores. And so this is just to show how with anxiety, you can see how between pre and post people were moved more toward the within normal limits in mild categories compared to moderate and severe. The same with depression. People were moved to a lower category. In terms of changes in inflammation, you can see that the mean IL-6 values were started in the moderate range of severity and decreased to within normal limits at the post-trek, and that the CRP, the pre and post values were already in a normal range, but that you can see that it increased slightly. And we are thinking that this CRP is a really good indicator of muscle inflammation, and that given all of the activity that's happening on the trek, that was one of the reasons why we think we might have seen a slight increase in CRP, but a small sample and in a pre-post. So we're not, making too many claims, but we're interested in at least the patterns are going in the direction we're thinking. So question I get, what if I can't spend a week in the wilderness? I wrote a piece about embracing the nature of your own backyard if you're fortunate to have a backyard, or even embracing the nature at your doorstep if you have a door that you can open and look outside. And there are many different ways that we can get connected to nature. It doesn't just have to be going on these big treks, even though that can be a nice motivation for a lot of people. I'm going to show you right now the video that I helped produce that focuses on Nature RX and the benefits of prescribing nature to our patients.
Makeup.
Trying to get some kills.
Hey guys.
Epic. Hey guys.
Some people work all the time. They come home, get on their phone, sleep. Or you go to school, go to work, get on your phone, sleep. If you're inside all the time, you're gonna feel like, ugh, what type of life is that?
Who do you draw? Baby. Pick it up.
I have to wake up at 5:30, walk to school. My first teacher, she's always screaming, so much homework in one night, barely have any time for me. I went to the emergency room a couple times because I would get these headaches where I would just be dizzy and I would get this chest pain. I thought that wasn't normal for a 17-year-old to have chest pain and headaches like that.
The time before I saw you, you went to the emergency room. They were kind of a little freaked out in the emergency room, I remember.
They would run tests and run tests. They said nothing was wrong with me at all. So, I came to the conclusion maybe it did have to do with stress because I was putting a lot on myself. When I'm stressed and angry, I feel hot behind my ears, around my neck. Like, I get really hot. And I'll get red. People tell me I get red. I ball up my fist. I really want to throw something. I want to hit somebody.
In many of my patients' lives, there's stresses. It wasn't until we had this crisis, going to the emergency room, that triggers in me, we got to do something about this. When I asked her, where and what do you like to do outside, she very much surprised me.
I told him I had a hammock at my father's house.
A hammock? She goes, yeah.
And he was like, you should go out there with nobody bothering you, no electronics at all. No electronics? I don't think I can do it.
60 minutes once a week, that is her prescription. A nature prescription is essentially spending time in an outdoor setting where there's nature. And what is most accessible for our people who live in urban areas are parks. There are certain elements to a prescription. One element of a prescription is the name of the medication. Then you have to have how many and what frequency, and then how much you're going to give. I've adapted this conventional prescription for a medication for nature. Jocelyn's prescription was for her to lie in her hammock and observe the trees every week for 1 hour.
At first, I thought, what am I supposed to do out there? Just sit all day? But, I did take this more seriously because it was a prescription. I started doing it once a week, every Wednesday for an hour when I come home. I tell my family, you guys can't bother me. My doctor said I have to do this.
And what do you do when you're in the hammock now?
I just sit there and observe because he told me that I should get away from my phone and stuff. And not
Do you turn it off? Do you turn it off?
Yeah, I don't have my phone with me.
You don't have your phone with you for 1 hour?
Yeah.
That's impressive. Okay, I can't do that either, so that's hard.
It was kind of cool. I've noticed things I've never noticed. The leaves changing. You can hear birds. Hear the wind sometimes. I never knew the clouds moved until I really just sat there and looked. I never believed people because every time I look at the sky, it's like nothing's moving. But if you really look at it, clouds move very slow. You have to really look at them to see that they move.
There's over 300 scientific studies that show a positive, strong correlation between time in nature and improved health outcomes. Some of the physiologic changes that have been noted are a decrease in cortisol, which is a stress hormone, and we can actually watch that number drop by virtue of spending more time in nature. We're only now putting this into practice as a prescription, but we've had thousands of years of experience with the benefits of being outdoors.
My chest pain, it started going away eventually. Before, the old Jocelyn, she would just lose it over anything. The new Jocelyn is a problem solver. She's learning how to keep her attitude under control. I know a lot of people with not the greatest attitudes, and, you know, I'll tell them, like, you want to change how you react to things or what you give your energy to. Taking time in nature is the best way to do it.
All right, almost ready to go outside. Being out in nature, in addition to the positive health benefits, we also know that it can increase our environmental stewardship. It can foster certain ecological sensibilities that prompt us to safeguard the well-being of nature itself. I've recently been writing on the importance of safeguarding Mother Earth through a couple different outlets. And while this is not well, things like reciprocity and interdependence, again, they've been talked about for millennia in traditional Chinese medicine, Buddhist teachings, indigenous knowledge systems. They have long emphasized this. You know, asking the question, where does the person end and nature begin? And in some of these writings, what I'm suggesting is that if you're going to prescribe nature to your patient, you might as well turn the card over and have an earth prescription on the other side. And it can be a really simple and easy way to bring it full circle back to the health of the planet itself. And in this growing age of eco-anxiety, where people are really beginning to fear and have complaints about these existential matters of the health of our planet and impending destruction, that possibly by helping people through these Earth RX prescriptions, we might be able to empower people to feel like they're having some effect. And albeit small, it's at least being able to do something. And as hospital systems, I believe I read a statistic where they are responsible for, I think collectively 5% of our emissions globally. We have a role to not only help promote this to our patients, but to also make our own systems changes. But this idea of habit stacking planetary health prescriptions on an existing Earth RX prescription is something that I'm interested in pursuing and seeing if we can build that momentum. That if we can help teach people that they are a part of nature instead of being separate from it, that there might be more thoughtfulness around it and being less destructive about it. And then we might be able to view these green behaviors no differently than other positive health behaviors that we're promoting, like getting enough steps or sleep or eat enough vegetables or drink enough water. That may be acting kindly to the earth through these kinds of behaviors, turning off lights or changing your lights to, you know, from LED to incandescent, using reusable grocery bags. The way we talk about it in the papers we've written about it is that each place has to create their own list based on what's doable for that particular environment where the hospital system is. There isn't just one list, but that there might be one or two things that every person can engage in. So finally, just a few takeaways. Nature contact is related to multiple health benefits, and it's a determinant of both human health, but also the health of our planet. We know that about 120 minutes a week being in green space is the magic number for human health, and that not all green space is created equally, and that being in nature is a birthright to everyone. And we need to make sure that we're doing things to create more accessible pathways and on-ramps for people to be able to be outside in a safe and healthy way. And backyards are good enough. It doesn't have to be these grand, huge, vast types of green space. That it can be sitting in one's front yard or backyard, and or lying, in one's hammock, like she was doing in the movie. So with that, I see we have about 10 minutes to the hour. I'm happy to take any questions or comments from folks. Let me see if I can turn my slides off or stop sharing so I can see. Okay.
We have a few great questions. We'll try to pick them as they came. I'm not sure if we'll have time for all of them. So the first question is, how can we become involved with your vision and leadership?
That's a awesome question. I'm not exactly sure what that, there's lots of ways I think to get involved in, if you're a healthcare provider, um, making and learning more and prescribing access to safe green space where patients are living, I think is one first step. And then, like I was suggesting at the end, flipping the card so there can be an Earth RX prescription tagged on that. That's, I think, one pretty quick and easy thing that maybe not all levels of healthcare providers can do, but maybe there's someone in the clinic. Maybe it's a social worker or a navigator or possibly a physician if there's time during the encounter. That's one. And then there are lots of advocacy organizations, both locally and nationally, that are really trying to help groups that have historically been marginalized or redlined from nature access to be able to have more safe, affordable, and healthy access to green space. So I think those are two ways that people can get involved.
Great, thank you so much. There are a couple of questions about will that last video that really resonated with a lot of people, could that link be shared, or will other resources be available after this?
Absolutely. Both of the videos are freely available, and I can make sure to, if you just Googled Take Care Campaign, no app required, you'd find it. But I can make sure that the link, is included in anything that you send out or that's made available online after this.
Wonderful. Another one. What studies do you know of with clinicians prescribing nature other than your own that shows clear effects?
Yeah, it's like most research, there are some studies that have shown positive benefits, and there have been some negative studies that haven't really shown the kinds of changes in psychological or physical outcomes that you would hope. But there have been enough studies now where there are reviews and meta-analyses of nature, or sometimes people call it nature RX. It started out, I believe, being called Park RX, and then it was broadened. We know that in practice, there are hundreds of nature RX programs across the US. The Canadian government has also been supporting nature RX initiatives, and they're now paying for park access for patients to go to all the national parks. So that's happening in the day-to-day. But there are, if you looked, park prescription or nature RX, you could find some review papers, and I believe there's a meta-analysis out there as well that looks at the literature. Like most things, there's a modest benefit to people. And I believe, if I remember correctly, it's when there was also some kind of a physical activity component aligned with it, that those things went really well together. So if you're going to go for a walk or go for a run, you might as well do it in a green space if you can. Is I think the message.
Wonderful. Thank you so much. What do you feel is the most important thing healthcare providers can do to help protect green spaces in our communities?
Yeah, that's great. There are some who are advocating that healthcare professionals make their voice heard, that being in nature is a birthright for all their patients, and that healthcare systems, as a leading contributor to global emissions in the atmosphere, need to take a more active stance as a system to find alternative solutions so that they're not prescribing as much, because prescribing as much as we do leads to the production and the waste of so many things that I don't have time to talk about right now, but it has to do also with the behaviors of healthcare systems, and then the systems that support healthcare systems like big pharma and other, being mindful about that piece, but then also advocating for more green space in communities, using smart, built design in the development of new hospital systems so that green space is incorporated, throughout the environment. And then, making sure to talk to patients about the importance of being outside in this way.
Wonderful. Thank you so much for those, great actionable points. I think maybe time for one more. Someone was mentioning how in some cases physical activity prescriptions aren't that effective for physical activity. Do you have any comments on how maybe instead of physical activity prescriptions, nature prescriptions might achieve the same goal with additional benefits?
I'm sorry, the question was, or that nature
Do you
prescriptions are
feel like nature
beneficial for.
prescriptions will increase physical activity as well for patients?
Well, I mean, I think there are a couple studies that show that it can, but it's not one of the main reasons why we would do a nature prescription. There are plenty of physical activity promoting interventions and programs as well. It can be a twofer, to be out in nature and get your steps, but it doesn't, I don't think that if you watch the video, it was more for that attention restoration theory based, or the other theory, the psychophysiologic stress reduction theory, more to help people be away from the noise of their lives and to almost facilitate this parasympathetic nervous system response so they can relax and be, without those other things. So I don't think that the nature prescription manifesto is explicitly to promote physical activity, but it could be a twofer if there are ways to get people to do both.
That makes a lot of sense. Well, thank you so much, Dr. Victorson, for this wonderful presentation. Judging by our Q&A, this resonated with so many people and left a lot of people feeling very inspired. So thank you for the work that you do, and thank you for the presentation.
I appreciate it. Thank you, everyone. Bye-bye.